Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the Hospital Finance Podcast. As a growing share of healthcare costs are increasingly becoming the responsibility of consumers, it's important to understand how people use and choose their healthcare benefits. To shed some light on this, I'm joined by Jeff Bakke of WEX Health, where he serves as Chief Strategy Officer. Jeff has 20 years of experience in business and technology management in the healthcare and financial industries, including leadership in national health plans and the consumer-driven healthcare space. Jeff, welcome to the show.
Hey, Mike, thanks. Glad to be here and great to join you.
Well, we're happy to have you. And for those of you in our audience who may not be familiar with WEX Health, can you briefly describe who you are and what you do?
Yeah, you bet, Mike. So WEX Health provides a healthcare financial technology platform for partners, about 500 partners, and these comprise of health plans, health companies, third-party administrators, financial institutions, a pretty wide array of organizations that deliver benefits and other healthcare-related technology needs.
Excellent. And today we're going to talk through some of the results from your first ever WEX Health Clear Insights report. And Jeff, can you tell us why you decided to conduct this research and what you were trying to find out?
Yeah, we really wanted to make sure that we were getting deep in terms of helping employees being better prepared for healthcare expenses. I think, your listeners know that deductibles have gone up considerably over the last several years, and we see, if that's a problem, we see preparing for out-of-pocket expenses as the cure. And so one of the major things that WEX Health does is provide solutions for consumers to help them pay for out-of-pocket costs. And these are health savings accounts, flexible spending accounts, and other account-based products. We work with 9 of the top 20 HSA providers in the country. And we wanted to get pretty deep on this. And so we decided to work with Zogby, and we polled about 1,100 Americans and asked them, a bunch of very specific questions about their employer-sponsored health insurance, their decision-making process, some of the ways they think about preparing for these costs and what they're spending the money on. In addition, we worked up some very specific calls to action for our partners to help them, with the 300,000 or so employers that they support and the 25 million consumers out there that we can reach to help them prepare for these expenses and hopefully reduce the problem for hospitals and other healthcare providers in terms of outstanding receivables and other things with consumers that are not able to pay.
So, Jeff, the report has several key findings and suggestions in it, and I'd like to focus in on a few of them with you. First, let's talk about high deductible health plans and HSAs in particular. You found that more than half of the respondents didn't know they could invest in their HSA. Could you tell us about that?
Yeah, you bet. If high deductible plans are the problem, and I know a lot of hospitals and your listeners probably think of them that way because it creates a consumer responsibility amount. Health savings accounts are really other cure, and so we want consumers to understand that, how they work, and use them to be prepared for these out-of-pocket expenses. We learned about half of the respondents believe that 401k accounts actually offer a more advantaged pre-tax savings solution, and they weren't aware that, in fact, as a HSA account holder, not only can you invest your funds, which is really important, but you can also withdraw them tax-free. There actually is every 401k advantage in an HSA, plus the ability to take the money out early and not pay a tax, both pre and post-retirement. So there's a lot of advantages to an HSA over a 401k, especially as it relates to healthcare spending. And then 3/4 said that they see their HSA as a way to pay for healthcare expenses this year, suggesting that they may be unaware that funds can get carried over from one year to the next. Because, especially as a hospital, you don't know when you're going to be in the hospital. It's hard to prepare for that. in a given year. And so we want to make sure that, people that have a health savings account or are considering one understand that, this might be a hospital visit 5 years from now that you're saving up for now. And that's important capability.
Yeah, you bet. And you also found that high deductible health plan participants feel that they make smarter health decisions, which kind of dovetails, I think, with what you just said. Why don't you tell us about that?
Yeah, I think, there's financial advantages here, but one of the biggest things about consumer-driven health plans and high deductible plans is it really engages the employee and the consumer now into thinking about, their actions in their own health and how that impacts their financial wealth. And people talk often about health and wealth, but 82% of the participants in our survey, those that were in high deductible plans, they somewhat or strongly agreed that managing their healthcare spending helps them be smarter about their own health. So you see this kind of transition from my wallet to actually my physical health. 3/4 of the respondents like the fact that they get lower premiums because there's a high deductible and they are more focused on their health and taking some financial responsibility in that. And then the primary reason that these individuals enrolled in an HSA in addition to their high deductible plan was to prepare for future health care needs, about 36%, and then the ability to save for out-of-pocket or future unexpected medical costs, 29%. So, a lot of the consumers that have these products and really understand them are starting to get it, which is great.
You bet. And unexpected healthcare costs, as you mentioned, they're always a concern. And it appears that men and women look at this a little bit differently, which I thought was interesting. What did you find out?
Well, just in terms of men and women, not surprisingly, and my wife would concur with this, that it turns out that women are a little bit more responsible, a little bit more prepared, and frankly, quite a bit smarter about these matters. Men are more likely to use personal savings, 18% versus 11%. They're more likely to use credit cards, 28% versus 15%, to pay for unexpected healthcare bills. It just speaks to, I think the female head of household, being a little bit stronger. They're more worried about finances. Of men, 14% were not at all worried about unexpected out-of-pocket costs, compared with just 4% of women. So some good data points to, I guess, drive home the point. It shouldn't surprise anyone that 2/3 of those surveyed are somewhat or very worried about unexpected out-of-pocket costs of current healthcare needs or illnesses, and nearly half are also worried about healthcare and retirement. I saw one stat the other day that half the people in the country are just as worried about the cost of a significant healthcare issue as they are worried about the actual healthcare issue, which is pretty startling when you think about that. So it really is important, I think, to do what we can in the industry to not have Americans spending all their time worried about this stuff. I know that 3 years ago, Monmouth University did a survey of Americans, and they asked them, what are your biggest financial concerns? And tied for first were 3 different categories. It was losing your job, household expenses, and healthcare, and they were all running about 13%. This last year, healthcare jumped up to 25%. I think that's a reflection of the deductibles rising and other things. And so bringing these solutions to both men and women and making sure that they understand them, super important.
So let's pivot and talk about consumer engagement then. And we know that employers offer different educational tools during open enrollment to help their employees make informed choices about their health coverage. What resources did you find consumers preferred?
The respondents indicated that they really liked emails, text messages, and one that we were a little bit surprised about maybe is online goal trackers. And we've just implemented over the last couple of years now some capabilities in our platform that helps consumers save up for these expenses and really kind of guides them in a little bit more wizard-like fashion to do that. So these resources are the preferred modes of communication and ways to help them make better health choices. These things, we're excited to automate and personalize, which I think is super important. We think about providing a great experience to a consumer. We've really advanced beyond a single experience, and we think about this much more as understanding a consumer's health and wealth situation, and then personalizing a lot of this information and messaging, based upon where they're at in their life stage, their financial health, and their physical health.
Of course, the report has all kinds of additional information in it. Jeff, if someone wanted to get a copy of the report, where can they go?
Yeah, great question, Mike. You can go to www.wexhealthinc.com/clear insights, and you can get it's a really nice report. Our team worked very hard on it, along with a lot of data and sort of a better understanding of the American population and how they interact with this. You'll get some good information and insights on what to do about that.
Jeff Bakke, thanks so much for joining us today on the Hospital Finance Podcast.
Thank you, Mike.
If you have a topic that you'd like us to discuss on the Hospital Finance Podcast, or if you'd like to be a guest, drop us a line at update@bessler.com.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler. Smart about revenue, tenacious about results.